Hi, this is Challen E with Bringing Acupuncture Mainstream One Talk at a Time. And I want to continue my talk about pain and misalignment. So one of the things I said in my last video was that it's not necessarily and should not necessarily be the objective of an acupuncturist to go, or anybody that, in my opinion, to go in and try to restore alignment just because something's off. I mean, clearly when a bone is off, it suggests that there's a problem in that area, but there may not be any symptoms associated with that misalignment either. And that could be as a result of somebody being born like that, a long-term misalignment that the person is not noticing any direct indications or symptoms as a relation to that. So it's not a very, it's often not a very worthwhile exercise to realign things for the sake of realigning things, in my opinion, in my observation and my experience as an acupuncturist over the last 10 years. So, but what is also possible, and this is what I wanted to bring up, is that sometimes misalignments are acute misalignments, and you have to do a little bit of a talking to the patient and finding out what the patient history is and what they had just done. There are cases, not necessarily contrary to what I said before, but you do consider that a bone misalignment could be as a result of something that just happened. Now, to what degree that is unknown unless you happen to have an MRI or an X-ray or had checked that patient the day before or prior to their incident. Maybe you had checked their spine, for example, and it was okay last week, but after they, were playing football last weekend and they went into this weird position and got tackled, something's wrong with that vertebrae. Okay, so in that case, you have a little bit more insight that bringing that bone back into alignment, and I guess I may be talking to some of my chiropractor friends, but as an acupuncturist, you may notice these things also. So some tweenah, and although you're not going directly after the bone, you're pushing on the tight muscles as a result of an incident that recently occurred, can also help with the relationship between the muscles and the bone and correcting alignment that way. So that's something I wanted to address, because I didn't really address it on my prior video. But I think in general, what I say is true. In general, most injuries and most misalignments are more congenital or long-term, and so very much care needs to be taken by the acupuncturist when seeing these misalignments and thinking that maybe they, through acupuncture or whatever, acupuncture itself would be a very safe way to try to reduce the tightness of the muscles around there. And sometimes just relieving the muscle tightness can help the body realign some of the bones that are associated with that tightness. So what else do you want to know? So I just wanted to, this whole video was to differentiate between what situations may be called where a physician is called to restore alignment as opposed to just relieving the symptoms. Of course, relieving the symptoms is always paramount, and it may not require as much of what a chiropractor would consider an adjustment to relieve that. So I think the first and foremost thing is the patient is in less pain. That's the main symptom. That's the main indication of why the person came in to begin with. They may not necessarily realize anything's out of alignment, but they do know that they have pain. But the good thing is, from an acupuncturist standpoint, when you do relieve pain, it's not, we look at it as one of the things that one of our teachers told us in acupuncture, Chinese medicine school, was we are jump starting or starting again the healing process that the body abnormally stopped. So If it's an injury that it's not fully healed, we're looking at it as acupuncture is starting that healing process again. So on that note, I'd like to leave you with that. And so this is Challen Yi with Bringing Acupuncture Mainstream, one talk at a time. And I'll see you on the next video.